everyone, today I am with my friend Chloe from Anomalous Chloe. She makes really great videos about travel and uni life and lifestyle, fashion, makeup, all the great stuff. I thought today we could talk about working in mental health because Chloe is training to be a mental health nurse. I mean, I'll let you explain.
Very nearly.
I'll let you explain it.
So I am training to be a mental health nurse at London South Bank University. It's a 3-year course and I will graduate this year, so I've done kind of like 2.5 years now. So you spend like 50% of your time at uni doing like the academic side of it, and then you spend the other half of your time like working on wards or in community services and things. I've been in community services.
I guess first of all, what made you want to like go into mental health? Because I mean, nursing, there's 3 sections in like generally adult, children, and mental health.
Yeah, you've also got kind of learning disability, but not as common sort of thing. But yeah, so those are kind of like the 3 main branches of nursing.
So what came in first? Was it nursing first or mental health first?
I'd probably say nursing. Like I always wanted to be a doctor when I was a kid.
Okay.
And then I got older and realised what is actually involved in being a doctor. I was like, I don't want to do that. And like I would have actually done like chemistry at A-level, and I hated chemistry and things like that. So then I was leaning more towards like the nursing side of things. And then as I got older, I used to watch quite a lot of like documentaries about things like mental health and stuff like that. So I guess to begin with, it was more of like an interest. And then I kind of saw a careers advisor when I was in year 12 and was just sort of saying, these are the kind of things, because I didn't realise that like mental health nursing was a thing. I was more leaning towards like doing like clinical psychology.
Yeah.
But I looked into it and it's like A, really difficult to get into, and B, you have to do like a psychology degree first, and I was like, I don't really want to cover the whole everything to do with psychology when I just want to work in mental health. And then this careers advisor was like, why don't you be a mental health nurse? And I looked into it and I was like, oh my god, this is exactly what I wanted to do.
Like pretty good match.
So it literally worked out perfectly for me. I think if I'd have gone and done like a psychology degree, I would have just got bored out of my brains, like for 3 years covering everything. Like I like the fact that when I started my training, I was in uni for 6 weeks and then I went straight out onto a ward. Yes, you're learning stuff in uni, but actually you learn how to be a nurse on the wards. I definitely think this was the right choice for me. I think I would have dropped out if I'd have just done like psychology.
Yeah.
I would have been bored out of my brains.
The thing is, when I had like my careers meeting thing, they give you like a quiz to fill in, and one of the things it said for me to be was a therapist, but like I was doing maths, further maths and Spanish at A. To be fair, I did do psychology, AS. I didn't go into that. The other thing was like a tax something. That's probably a lot more what I...
like financing kind of stuff.
It was something like a debt collector or something like really serious and horrible.
Polar opposites, like tax collector, therapist. Like I went to a careers advisor when I was in like secondary school, and they were just useless. Don't worry about anything else, just go and do anything at uni. It's basically what this careers advisor told. She was just go and do any degree and then you'll get a job. And I was like,
Does it benefit school if people get into university? So does it make the school
I think so.
So they try and push that on you.
You know, then they can turn around and be like, 80% of our students went to university kind of thing. Like
it wasn't really advertised for anything else for us. Like we had some gap year people come in and talk to us, but that was kind of it.
It was the same at my sixth form. My sixth form was just like, right, you guys.
So you go on placements. How long do they normally last? Like 6 weeks?
So my shortest is 6 weeks, but then my longest is 12.
Okay.
But they were kind of anywhere in between that. You can go 7, 8, 9.
What sort of things are you working in? Like I don't know how much you're allowed to say as well. Like it's a bit of confidentiality.
Yeah, obviously you just I wouldn't give you a specific example. Like I met this one girl that was like, but you do quite a wide variety, or at least you're meant to. So my first ever placement was in older adults, which is kind of like, it's dementia specific. So obviously normally if you have dementia you'd go to a care home, but if you have quite challenging behaviour and they don't know how to manage it, then you might go to like a specialist dementia unit. So I worked on that for 3 months, which is a very long 3 months. But it was quite handy because obviously in older adults you do quite a lot of like physical hands-on care, because a lot of them have got physical health conditions. So it was very good to gain like a general
kind of
nursing experience. And then after that I went into a male acute admissions ward. So that's kind of your bog standard ward. If you were admitted into hospital, you'd probably go on like an acute admissions ward. Then I went into CAMS. I did a CAMS inpatient. I think our youngest patient was 12, and then it goes up to 17. Then I was in a male PQ, which stands for Psychiatric Intensive Care Unit. So if you are too unwell to be on an acute admissions ward, you might go to a PQ.
Okay.
And it's kind of like less patients, more staff.
So more kind of intense.
Yeah, more intense.
Yeah.
So that could be multiple reasons. It could be because you're really risky to yourself. It could be because someone's really risky to other people. Loads of different things. Then I worked in drugs and alcohol. So like methadone prescriptions, things like that, which was quite a challenging placement, because normally, like, when people are unwell, they kind of want to get better. You know, no one wants to be in hospital. No one wants to be in that situation. But I think in drugs and alcohol, it was quite hard, because a lot of people were just like quite happy on their methadone, not wanting to change, and you kind of go into, you'd have like therapy session type things with them, and they'd be like, can I just have my methadone script, and want to leave. Not always, not all of them, definitely not, but quite a lot of them. And as like someone who wants to help and like wants to, it was quite a difficult situation to be in. And then I've just been in CAMS community, so obviously a lot of people that have mental health problems don't go into hospital. You'd stay in the community and you'd have like a care coordinator. So I was in there. That was my last placement, and then I've got one more until I qualify.
So like, how kind of, well, not hands-on, but how much responsibility in the roles do you actually have?
What, like as a student? Quite a lot. Essentially, I can do everything that a qualified nurse can do. I just have to get it checked. Things like medication, I couldn't do it on my own, but I could do it with another qualified staff, and you just sort of like check each other almost, because you always have to have, even when you're qualified, you have to have someone else check your medication. I can do like care plans and risk assessments and things like that. I would then just have to have a qualified nurse check it.
Check over.
So you pretty much do everything that a qualified nurse would do. You do like, on a ward, you'll have like one nurse that's in charge for that shift. I do that. You just
cool.
Pretty much go and do everything.
So it's not just like shadowing someone.
No.
Does it start off that way?
Yeah, I'd say to begin with, the first sort of couple of days, literally, you're sort
every
of more.
placement, or just the first one?
Sort of depends on how different it is. Kind of, if you've had like a similar placement. So if I went onto a ward now, I wouldn't shadow, because I've been on wards lots of times. I know exactly what I'm doing. But the first kind of few, or maybe like a completely different environment, you might shadow someone for a little while. But normally, even if you say, can I watch? They'll be like, no, come on, you can do it. It's very, very little shadowing, and very much do it and I'll be here to support you. If it goes wrong, I'll take over, but otherwise, do it yourself.
A lot of my subscriber base are like either people who are interested in mental health in general, or people who have struggled with mental health problems. Would you say like it's quite distressing to like have your own experiences and then go into like a sector like this? I don't know, because it's difficult, because obviously everybody like is at different places within their recovery and stuff. But would you say, like, if you are someone who's struggled with something like that in the past, would it be an okay thing to do, or would in general like going into mental health nursing or something like that be maybe like triggering or anything like that?
I think it depends on the person. Like, quite a lot of my course mates have had their own mental health problems when they were younger, some more so now. Some people would consider themselves kind of like totally recovered, other people sort of still have dips. And again, I've met a lot of mental health nurses that have had their own mental health problems. So I think you've got to be pretty stable. You know, if you're really, really struggling with your own mental health, you're not going to be able to help someone else. Like, I always think of it as like, you know, when you're on a plane and they always say like, you need to put your own oxygen mask on first. You know, you are not going to be able to help someone if you're really unwell yourself. So I think you've got to generally be in a good place, but that doesn't mean you can't have dips, because everyone has dips. That's perfectly, I don't want to use the word normal because there's no such thing, but that's perfectly typical. You know, people do dip. I actually think it makes you a better mental health. I'm not saying that people that haven't had their own mental health problems are bad mental health nurses. I think it makes you a much better mental health nurse in the sense that you can just really, really empathise. You know, I have met some staff, because I'm sure you're bound to have met staff that are just useless. Like, I've met some mental health staff where it's like, why would you want to do that? And I'm like, well, they're not exactly choosing to, like, you know, self-harm's a good example of this. Like, I've met mental health nurses that have turned round to patients and said, why would a pretty young girl like you want to self-harm? Got nothing to do with, like, that's not going to stop it.
Sometimes, like, tough love is like a helpful thing, but sometimes it's not.
And you have to know the person, doesn't it? You know, you wouldn't say that to someone you'd met 10 minutes ago, kind of thing. Like, if you know them and you know, I respond quite well to, like, shut up, get on with it, kind of like, that's what I respond quite well to. But if you've met me 10 minutes ago, you're not going to know that. And if you do that and I'm not that kind of person, that's not gonna end well. But I think, so long as you're pretty stable yourself, I don't see any reason why someone can go into mental health. But obviously just be aware you are gonna see and hear a lot of things that might be triggering, you know, because I've had to support people in their self-harming. I've had to physically hold people to stop them self-harming before. So if you're someone that would see someone else self-harming and really, really be affected by that, you know, you've just got to be sensible about what you think you can handle. And generally I find talk to your university, like if you tell them, when I was younger, I used to have an eating disorder, I would rather not have a placement in an eating disorder unit because I would find that difficult. They're not going to force you to go there. Like, so I think talk to your uni, sort of tell them what's going on, let them know what's going on, and then that way they can support you better. But I don't think there's any reason why someone can't be a good mental health nurse that has either had or continues to have their own mental health problems within reason. Like, you know, if you're still in and out of hospital, it's not the right time. Wait 5 years and you might be in a completely different place.
Exactly, like even if it's not right now, maybe like at a different point in your life, you could be at a better place to be able to deal with everything.
And I think actually if you've met a lot of mental health professionals, you're going to meet good and bad. Like I'm getting you've like met people that are just useless.
Yeah, but there's also people who are like really great.
Exactly, but actually seeing that and knowing before you go into an environment, this is the kind of nurse I want to be, I think that's really helpful to sort of know what you didn't like and what you did like, and you can really incorporate that into your own practice. Like I do that a lot. Like when I was in older adults, for example, my attitude was always, would I be happy if someone was treating my nan like this? I've never had dementia, I've never had to have someone care for me in that capacity kind of thing. So I think having that in your head, like, would I be okay if a nurse treated me like this, is a really good way to make sure that you're going to be like the best nurse you possibly can.
I had 3 flatmates in first year that did nursing. 2 were adult nursing and 1 was mental health. And they had like, the first year was basically all the same for them, I think.
Yeah, we had a lot of similar stuff in first year. Because I get this quite a lot. Obviously I have quite a few videos on my channel about being a mental health nurse and things like that. And I get people messaging me all the time like, I really don't like, for example, blood. Would that be okay? And I think although you do have some element of physical health, like it's not as much. We don't take blood, for example, only because you don't do that as part of the nursing qualification anyway. You do that as like a separate qualification afterwards, and that's why you can have people that can take blood that aren't nurses, but you won't have to do stuff like that as part of your nursing training. So if you're really squeamish about blood, you can cope as a mental health nurse. Like it's not going to be ideal, because like I said, sometimes I've had to support people when they've been self-harming and things like that, and we don't like suture wounds, but if it's like a superficial wound, you might put bandages on it. So I mean, if you are completely like opposed to all bodily fluids and things like that, maybe you might struggle. Yeah. Maybe. But if you can handle it, you just kind of don't like it, I can't see any reason why people would struggle with it, because I mean, it's very rare. It's not like on a daily basis you're coming into contact with bodily fluids. And the same with needles. I get a lot of people say like, I'm terrified of needles, could I be a mental health nurse? And we don't really, depending on where you are, like if you're somewhere like a PQ that I mentioned earlier where you've got really, really unwell people, they quite often administer medication like by injection because someone's too unwell to take their medication. I've given 3 injections in 2.5 years.
Oh, wow.
I've
given more injections than that, and I'm not even...
like it's not very common. Obviously, depending on where you work, you know, if you're in drugs and alcohol, you'd probably like, actually no, saying that was where I did most of my injections. Where would you like, or like in CAMS, it's quite rare. We don't give very many injections in CAMS and things like that. Before I did my first injection, I was terrified, like absolutely terrified. I'm not scared of needles at all. Like I've got piercings, I've got tattoos, but the thought of putting a needle in someone else, like I might hurt them and I didn't want to hurt them kind of thing. So I just kind of told my mentor, like, I'm petrified of doing this, and she was great. She gave me like loads of oranges and like fake needles, or like not fake needles, but like expired needles, like ones that we didn't need anymore. And I just sat there like poking an orange, because that's what I think I was worried about. Was like, how do I hold it? How do I like push it in? Like what do I do? So I think actually like practicing it beforehand. So I think generally, if you just tell, like you'll have a mentor, no matter where you are on placement, you'll have a mentor, which is like a nurse that kind of like is responsible for you. I think if you just tell them like, I'm quite anxious about this, or needles terrify me, or whatever it is, they're pretty good at like helping you through that.
So because you've got like a basic kind of knowledge of nursing in general, is it possible for you to kind of switch like disciplines at any point in the future? Do you have to go back and completely relearn everything?
I think you'd have to restart, so I think after your first year of uni you can swap between the disciplines. You'd have a little bit of catching up to do, because there's some things that are like branch specific, but after your first year you can't really change without going back and training again. So you can do what's called like a PG dip, which is like a 2-year course instead of a 3-year course. So I could, like if I wanted to retrain as an adult nurse, I could go back and do my PG dip in adult nursing, but that's like another 2 years of training. It's not like a...
Would that be government funded still? Or would you
not now. Not now, it wouldn't be. It used to be, so you could have done 2. There are some courses like I was considering going to Oxford Brookes, because Oxford Brookes do like a 4-year dual qualification. So I could have done like mental health and children's nursing is what I would have done. But I think you can do mental health and adult as well, or you can do like adult and child. So it's just 4 years instead of 3, but then you come out with both.
Okay, so then you can
work in both. I don't think that's very common though. I think Oxford Brookes was the only one that I looked at that had it. And I think after the first year of, I don't know, say you did like adult nursing and mental health, if after the first year you really, really hate the mental health stuff and love the adult stuff, or vice versa, I think you can then transfer back to the main 3-year programme.
Courses at uni are like that, like within reason you can probably switch between things. Like
Yeah.
I switched from math to Spanish to maths.
You're not going to be able to do it like right at the end, but like, you know, providing with normally within the first year, I think you can switch if you sort of decide this is really not for me.
Yeah, it's a lot better than doing that than having to like restart the whole year, which you've basically done most of already.
Yeah, because I mean, with us, like a lot of our, so towards the beginning of the course, you have quite a lot of general modules which you share with all the other nurses. But like this year, I only have 2 general modules. The rest are mental health specific. So it kind of gets more and more specific as you go along. There is that option to swap because you covered the same stuff that the other nurses have done anyway. You've just done like 1 or 2 things different.
I don't know how much you know about this because your like experiences in mental health nursing, but what other jobs are there? If you're interested in, like, maybe you have had experiences in the past with mental health, maybe mental health nursing isn't for you at the moment. Like, is there something else in that kind of sector which maybe is less kind of intense, like hands-on? I don't know.
So obviously you do counselling is quite a, I'm pretty sure that's a 3-year course as well. I think you can do like a degree in counselling, which is going to be a lot less, I guess, hands-on sort of thing. So if you are really opposed to like blood and needle, you know, absolutely no way petrified, I think things like counselling are a good route because then you're working with people that are in a slightly better place in the sense that they haven't been forcibly admitted to hospital. So that's going to be, if you are someone that's like very, very susceptible to triggers, that's probably going to be a slightly safer environment for you. And obviously psychology as well, you can go down the psychology route. Like I work with a lot of psychologists and a lot of like clinical psychologists, and they do quite a similar role in the sense that they offer like interventions, but they don't do the medications, the bloods, and it's 9 to 5 because obviously nurses we do shifts and things like that. So if you don't want to do night shifts and earlies and lates and bank holidays, sort of counselling, psychology there, you know, your regular weekday hours kind of thing. But you can also specialise in therapies, so that's something you can do as a nurse as well. So I could potentially go on and do like a CBT or a DBT course. So you can do that. You can do, I think you'd have to do a psychology degree first, and then you can do like a master's in something like CBT or DBT, or I mean really any type. You can get like family therapists, things like that. So I'd say if you're really, really opposed to the medical side of things, your best bet would probably be to do a psychology degree, because then you can go into all the different like therapies.
As well, with therapies, quite often you're working from like a single base, like your office, so you can control a lot more things when you're just in your little space and you know what you're doing.
Yeah.
So I think like going out on loads of different wards and doing loads of different things, that's a big kind of unknown factor. So if there's like one less thing to kind of worry about, that might help.
I think wards can be very overwhelming sometimes, because I think adult wards particularly, I mean this varies from trust to trust and things like that, but I mean in my trust your typical adult ward is going to have like 20 patients. So if you are someone that gets like quite overwhelmed by sort of, you know, a sensory overload type thing, you'd probably really struggle on a ward. You've got one patient screaming because they want to go out and, you know, they're under section so they can't leave. Somebody else is having an argument with their other half on the phone. Somebody presses the panic alarm by mistake. Obviously not every day is like that, but if you're someone that really struggles with that kind of like, whoa, there's so much going on right now type thing, then a ward probably wouldn't suit you. But like you said, if you're in kind of like a more therapy role, then this is your environment. You have one patient come to see you. It's kind of, you have a little bit more control over the situation.
What did you do at A-level? Did you have to do sciencey things?
No, they don't really have, there's no specifics. I mean, I did biology and psychology, which have definitely helped me, but I wouldn't say they're essential. Like if they're not...
So there's not like a requirement to do any of that?
No, I don't think so. I think there was one uni that required you to have biology that I saw anyway.
Wow.
But the vast majority...
Wow.
And actually the... at least in mental health nursing, like the biology stuff, like you do anatomy and physiology, it's kind of like a lower standard than I did at A-level. So I covered a lot more at A-level than I did in my first year of nursing. Obviously if you do like adults or children's nursing, you have to do a lot more of that, because obviously it's very specific kind of thing. So it's all about like health essentially. You don't need to know the kind of stuff you know at A-level that's all theoretical. You only need to know about the body and health and what's not healthy and things like that. And then obviously psychology, I find it quite helpful because a lot of our assignments are looking at what's called like the biopsychosocial model. So it's the idea that mental illness isn't caused by one thing. You know, you don't have an imbalance in the brain and that's it. You just, you become unwell. It's kind of a factor of all different sort of like biological factors, which would be your chemicals in your brain type thing, or genetic heritability. Psychological factors, so that's things like trauma, stress, bullying, all those kind of triggers. And then social is again kind of sort of overlaps with the psychological one. So I covered quite a lot of that stuff at A-level when I was doing A-level psychology, so that helped me a lot. but then I've met people that didn't do that and they've done fine. So I'd say if you do want to go into mental health nursing, just do whatever interests you at A level. The important thing is just that you get on the course.
Yeah, just so get some A levels.
Just get on the course. Or even things like health and social care at college, like an extended BTEC.
Okay.
I'm pretty sure you can still get on with it. Providing obviously you've got to get quite high grades because it's perceived as easier than A levels. But yeah, I'm pretty sure you can still get onto the course with like a level 3 extended diploma. Just do whatever the hell interests you to get you enough UCAS points to get on the course.
Yeah.
But if you are interested in like biology, psychology, and you want to do them at A level, it's going to be a help. Like it's definitely going to help, but it wouldn't hinder you. You're not going to like fail your degree if you haven't done them.
That's kind of the same for maths, because there's further maths A level and everyone thinks you have to do that to a maths degree, but you don't.
Oh really?
Like, yeah, I mean I did it, and I think like basically most of the first year was kind of a follow on from further maths, but like they start at the beginning, so you don't need it.
Oh, so if you hadn't done it, you'd still be able to.
Yeah, like most people I don't think did it. But,
I didn't know that.
Yeah.
I would have thought you'd had to have done like all the maths.
Do you have anything else you want to say?
I don't think so. I think we've kind of covered everything.
Yeah, thank you.
And obviously, like I said, I have people like DMing me on Twitter and Instagram and things like that all the time. So if you are considering going into it and you want to know some more, feel free. Just drop me a message. I mean, I might take a couple of days to reply. I do it all the time where I open my messages like when I'm at work and then like the alarm will go off. So I like completely forget, and 2 days later I'm like, oh, I didn't reply to that person. But yeah, if you are looking at going into it, I'd be happy to answer any more questions if you've got any.
Also check out Chloe's videos. Have you done one or more than one? I think you've done a couple on mental health. Yeah.
I've done a few.
I'll link
I
them.
forget.
And wherever, down there, up there, that side.
That side.
Thank you for giving us all your knowledge. I've learned a lot, so I mean I'm not even interested in going into these things, but it's nice to know.
This thing,
and
I just like being nosy. Like I watched your maths video, and I was just like,
I have no intention of studying
maths, but I was still like, oh, that's quite cool.
Yeah, I mean it's good for me as well to know, like see a different perspective, because I'm normally the one like on the treatment end. I don't really know what's going on in the head of the person who's like working with me. So it's good to know.
And I think that's the thing, I think a lot of people forget that like the person you're working with wanted to go into mental health at some point. I think sometimes you can meet like bad mental health practitioners and people are like, ugh, why would they go into that? And you think like 10 years ago they probably were like really into it, and it's only because, and it's not acceptable, like you still shouldn't get poor treatment off someone, but you know, because they're really stressed or they're understaffed and things like that. I think sometimes people perceive mental health staff in a really, really bad way, because there are a lot of bad staff.
When you're kind of fighting yourself mentally and then there's someone else like adding their own voice into it and they just kind of feel like an enemy, even though obviously they are trying to help you, it's just feels like a battle with them as well. I don't know what video we're filming on your channel.
No,
so.
We're going to film something on my channel though. You got to go watch that.
Yeah, I'll link it, whatever it is. Thank you very much for watching, and I'll see you very soon. Bye!